Good day, everybody. This is Tonetta coming to you with part three of At the End of Life, Comfort and Care. And I'll be reading to you about care options today. And of course, there's all different kind of care options for somebody that's at the end of life. And like I said, I'm going to get into that right now. And again, I'm reading from End of Life, Helping with Comfort Care. I'm reading from the same manual. And I'll go ahead and get started. Decades ago, most people died at home, but medical advances have changed that. Today, most Americans are in hospitals or nursing homes at the end of their lives. Some people enter the hospital to get treated for an illness. Some may already be living in a nursing home. Increasingly, people are choosing hospice care at the end of life. Hospice can be provided in any setting: the home, nursing home, assisted living facility, or inpatient at a hospital. There is no right place to die. And of course, where we die is not always something we get to decide. And unfortunately, I know I said that in the beginning that respect the person who is dying, I guess their wishes as far as what they want to see happen. But like this just said, sometimes we don't get that choice where we can no longer talk or speak, or we're in a coma or that kind of thing. Sometimes we have to be transferred out to a medical facility or a nursing facility that can best care for us 24 hours a day. So just keep that in mind. But if given a choice, each person and his or her family should consider which type of care makes the most sense, whether that kind of care can be provided, whether family and friends are able to help, and how they will pay for it. Because of course, all those stays in the hospital and different facilities, they do cost, and of course, Medicare, Medicaid, or whatever kind of insurance you have will cover some of that, but all of it may not be covered. And the family, of course, or those who are left behind will have those bills to pay. So just keep that in mind. In this section, we explain some of the care options available at the end of life. The first one being palliative care. Doctors can provide treatment to seriously ill patients in hopes of a cure for a long time. Doctors can provide treatment to seriously ill patients in the hopes of a cure for as long as possible. These patients may also receive medical care for their symptoms or palliative care, along with the curative treatment. And there's a small section in here is asking who can benefit from palliative care. Palliative care is a resource for anyone living with a serious illness, such as heart failure, chronic obstructive pulmonary disease, which is COPD, cancer, dementia, Parkinson's disease, and many others. Palliative care can be helpful at any stage of illness and is best provided from the point of diagnosis. So that means anytime that anybody that you know is diagnosed with an illness, whether it's anything dealing with the heart, heart disease, cancers, COPD, lung disease, any of those kind of things, that you can always request palliative care. Just keep that in mind at the beginning of the diagnosis. That does not mean that you're dying right away or anything along those lines. Palliative care, I'm sure they'll get into it, but it's more of a team approach to, of course, helping you with your illness, making sure that you're comfortable, making sure that you are getting the best medical care that can be given to you at that point by a team of people. In addition to improving quality of life and helping with symptoms, palliative care can help patients understand their choices for medical treatment. The organized services available through palliative care may be helpful to any older person having a lot of general discomfort and disability very late in life. Palliative care can be provided along with curative treatment and does not depend on prognosis. Like I just said, it does not depend on how long you have to live. Palliative care is available to anyone who has a chronic illness or chronic or serious illness that needs a whole team around them to, of course, assist with their curative care. A palliative care consultation team is a multidisciplinary team that works with the patient, family, and the patient's other doctors to provide medical, social, emotional, and practical support. I'm going to repeat that again. A palliative care consultation team is a multidisciplinary team that works with the patient, family, and the patient's doctors to provide medical, social, emotional, and practical support. This team is made up of palliative care specialist doctors and nurses, and includes others such as myself, a social worker, nutritionists, and chaplains. Palliative care can be provided in hospitals, nursing homes, outpatient palliative care clinics, and certain other specialized clinics are at home. Medicare, Medicaid, and insurance policies may cover palliative care. You would have to look into that to make sure that your insurance that you have or that the dying person has or the person who's been, I guess, offered palliative care. I guess I can't say dying because it's not dying, but the person who is, of course, living with this serious illness or chronic illness, you have to make sure that their insurance is going to cover the palliative care. 9 times out of 10, it will, but like I said, there's some little snafus out there, so I guess, in the insurance companies where they may not pay for the illness until the doctor has written the order a specific way. So make sure that you keep that in mind as well. Veterans may be eligible for palliative care through the Department of Veteran Affairs. Public health insurance might pay for some services. Health insurance providers can answer questions about what they will cover. Check to see if insurance will cover your particular situation. And for most insurances, actually all of them that I've seen, the number to call for customer care is usually on the back of those insurance cards. Or you can look at their website, one of the two, but I would say just call so that you can talk to a person and to get the information that you need and the questions answered that you need. And here's the story. It says Adriana's story. Adriana developed anemia while she was being treated for breast cancer. A palliative care specialist suggested that she get a blood transfusion to manage the anemia and relieve some of the fatigue she was experiencing. Controlling her symptoms helped Adriana to continue her curative chemotherapy treatment. Treating her anemia is part of palliative care. In palliative care, you do not have to give up treatment that might cure an illness. Palliative care can be provided along with curative treatment and may begin at the time of diagnosis. Over time, if the doctor or the palliative care team believes ongoing treatment is no longer helping, there are two possibilities. Palliative care could transition to hospice care if the doctor believes the person is likely to die within 6 months, or the palliative care team could continue to help with increasing emphasis on comfort care. And now we're going to get into the subject of hospice. Tom's story. Tom, who retired from the U.S. Air Force, was diagnosed with lung cancer at the age of 70. As his disease progressed and breathing became more difficult, he wanted to explore experimental treatments to slow the disease. Through palliative care provided by the Veterans Administration, Tom got treatment for his illness and was able to receive the care and emotional support he needed to cope with his health problems. The palliative care program also helped arrange for assistance around the house and other support for Tom's wife, making it easier for her to care for him at home. When the experimental treatments were no longer helping, Tom enrolled in palliative care. He died comfortably at his home 3 months later. At some point, it may not be possible to cure an illness, or a patient may choose to not undergo certain treatments, and that's their choice. Hospice is designed for this situation, or both of these situations. The patient beginning hospice care understands that his or her illness is not responding to medical attempts to cure it or to slow the disease's progression. Like palliative care, hospice provides comprehensive comfort care as well as support for the family, but in hospice, attempts to cure the person's illness is stopped. Hospice is provided for a person with a terminal illness whose doctor believes he or she has 6 months or less to live if the illness runs its natural course. So again, I'm going to let you all know, because I have some training, in hospice as well, with the End of Life Care organization that's here in St. Louis. I've been to several different kinds of trainings and workshops that they've had regarding palliative care. And like I just finished reading, palliative care is only given to someone, or someone is enrolled into that program, who only has 6 months or less to live, and there is no more curative treatment that can help help their illness. So just keep that in mind. It's very different from palliative care. Hospice is an approach to care, so it is not tied to a specific place. It can be offered in 2 types of settings: a home or in a facility such as a nursing home, hospital, or even in a separate hospice center. Hospice care brings together a team of people with special skills, and all of them are trained in the hospice as far as what to expect towards the end of life, and how to, of course, handle the body after the death has of course, has, of course, arrived. I guess I put it that way. Among these people that assist on the hospice care team, there are nurses, doctors, social workers, spiritual advisors, and trained volunteers. Everyone works together with the person who is dying, the caregiver, and the family to provide the medical, emotional, and spiritual support needed. And I just want to say that I remember I was, like I said, 19, 20 years old, 21 years old, when my mom got diagnosed. When my mom was in the hospital at the cancer treatment center, and they were saying that there was nothing else that they can do at this point, and they're recommending hospice. And like I said, at that time, I had no idea what hospice care was. I mean, they tried to explain it to me, of course, but they didn't explain that it was terminal and she could do nothing else and that kind of thing. There was no other kind of treatment that can help her. Like I said, I know all this now because I was young, and of course it wasn't fully explained to me like that. But now I understand what hospice care was and how it was, of course, helping my mother and those kind of things as well. Now I understand that. So I just want to say, for those out there who may have been my age when their mother, or currently my age when their parents or loved ones are, of course, expiring and they're near the end of life, just keep in mind videos like this or other videos that's on YouTube, Google, anywhere that you can find them, that's talking about end of life care, hospice care, palliative care, are very, very good educational tools for you all. I'm going to get back to reading. A member of the hospice team visits regularly, and someone is always available by phone 24 hours a day, 7 days a week. And that is the truth, you all. Somebody's always on call. Hospice may be covered by Medicare and other insurance companies. Check to see if insurance will cover your particular situation. The same with hospice. You have to make sure that your insurance company is going to cover it, and 9 times out of 10 it will, but you just have to ask for it. I also want to say one more thing. I know a lot of people are afraid to talk about palliative care, afraid to talk about hospice care, or anything, or either death, I guess, anything along those lines of anybody that's death and dying, end of life care, anything like that. And let me just say that palliative care and hospice care is available to everybody that's, of course, going through these processes, especially hospice. And everybody or anybody that has a serious illness or chronic illness that's going through treatments and need a palliative care team. These services are out there for all you all to use. Many folks do not hear about these services. The doctors are not telling people about these services. So that's why I said I want to make sure that I'm, of course, making a video like this so that you can know that these kind of services are available to you, regardless of what the doctor has told you or what the nurse has made available, anything along those lines. Just keep in mind that please spread the word that these services are out there for anybody. Palliative care, if you're just been diagnosed with a serious illness, and for hospice care for anybody that's at the end of life with 6 months or less to live. Like I said, these services are out there in the community for you all to use. And I'm a black female, as you all can tell, and a lot of times, our black communities and our more low-income communities are not told about these services. And that's the main reason why I'm doing these videos. I guess this series is to get the word out there, not just for the low-income or the black, I guess, African-American people or anyone of color, but for, like I said, those specific populations. There a lot of times they do not even get the option to even choose palliative care or hospice care. And I've been researching this a lot, and this statistics will show that I think it was about 20-25% of the time. Let me see. I think it was less than that. I think it was less than 20% for those who are people of color to receive hospice or palliative care, or even been given the option to even told about the program. There's a lot more, of course, that if they said they would have heard about it, they would have, of course, signed their dying family member up for hospice care or for palliative care, because the program would have worked for them and, of course, provided extra support for the household and for the caregiver. So like I said, we have to keep in mind, and please spread the word for those you're working with who are going through situations like this, whether it's palliative care or hospice care, that these programs are out there for anybody to use. And like I said before, usually the insurance will cover these services, but people just have to be made aware about what's going on and that these services even exist. So with that, I'm going to go ahead and continue reading. Choosing hospice, this is Dolores' story. Choosing hospice does not have to be a permanent decision. For example, Dolores was 82 when she learned that her kidneys were failing. She thought that she had lived a long, good life, and didn't want to go through dialysis. So Dolores began hospice care. A week later, she learned that her granddaughter was pregnant. After talking to her husband, Dolores changed her mind about hospice care and left to begin dialysis. hoping to one day hold her first grandchild. Shortly after the baby was born, the doctor said that Loris's blood pressure was too low. At that point, she decided to re-enroll in hospice care. And like I said, hospice does not mean, yes, they're giving you 6 months to live, but they're not gods. There's only whichever God you believe in, whether it's Allah, whether it's Jesus Christ, whether it's just God, heaven, universe, whatever, whoever it is. Your God, of course, is the person to me who would decide, of course, how long you have to officially live on this earth. Some people do enroll in hospice, and there are some that do, of course, come off of a hospice. The disease, of course, betters and that kind of thing, or they choose to seek other treatments, I guess I put it that way. And just keep in mind with me saying all this, I know I'm in the United States of America, and I know other countries out there who have, let me see how to put this, who have better treatment than here in the U.S., better treatment, better, I guess, studies, different things like that, that, of course, can help cure someone, I guess I put it that way. And if you're looking into those kind of treatments, of course, be careful. Try to make sure that you're of course, researching whatever's going on. But just keep in mind that hospice, they are giving you 6 months to live. But if you find something else that is going to possibly help you, whether it's in a different country or not, you can, of course, come off of hospice and try that treatment. And just keep in mind that if you come off hospice to try that treatment, to request a palliative care team instead. So just keep that in mind. You can definitely interchange those. So definitely keep that in mind. It is important to remember that stopping treatment aimed at curing an illness does not mean discontinuing all treatment. A good example is an older person with cancer. If the doctor determines that the cancer is not responding to chemotherapy and the patient chooses to enter hospice care, then chemotherapy will stop. Other medical care may continue as long as it's helpful. For example, if the person has high blood pressure, he or she will get medicine for that. So that means, you all, that if you're entering hospice care because of a illness that you were given 6 months to live with, whether it's some type of cancer, lung disease, or whatever it is, and you're given 6 months to live, that means entering into hospice care, those treatments for that particular illness and disease do have to stop. Meaning that with hospice care, they're allowing the natural disease progression to, of course, take place, and no more curative treatment is going to be assigned unless you're willing to, of course, stop the hospice care and do something different. So just keep that in mind. But they will, of course, treat other illnesses that you may have that you did not enroll in the hospice care. That was not the reason why you got into the hospice care, like your blood pressure or your blood sugars or mental illness, that kind of thing. They will still treat those kind of things, but just not treat the major illness that put you into hospice care. There is actually a chart, but I'll actually just keep on reading. Although hospice provides a lot of support, the day-to-day care of a dying person at home is provided by family and friends. The hospice team coaches family members on how to care for the dying person and even provides respite care when the caregivers need a break. And keep in mind that they do have respite care that they can give you. It's free services while that person's in hospice. Respite care can be for a short few hours or for as long as several weeks. And in situations like that, for long as several weeks, they can, of course, place the person temporarily into a facility in order to, of course, give you that respite and give you that break. Annie and Maria's story. 80-year-old Annie had advanced metastatic melanoma, and asked for help through a hospice program so that she could stay in the home she had lived in for more than 40 years. After Annie died, hospice continued to support her family, offering bereavement counseling for a year. Hospice services greatly reduced the stress of caregiving for Annie's family. This was especially true for Annie's wife, Maria, who weathered the sadness of her loss without her own health declining. And like it said, hospice is there for the dying patient, but also the family as well, the same thing as palliative care. But hospice, of course, after the person has expired and passed on, they will still provide support to the family up to a year after the person has expired. And of course, that's through phone calls, or if you need them to come by to, of course, work through the grieving process with you. They know that you're grieving and they know that you need assistance, and they can, for free, help you with those kind of things. So just keep that in mind. Just because the person has passed and expired does not mean those hospice services stop at least for a year after the person has been gone. Family members who receive care through the hospice program are more satisfied with end-of-life care than are those of people who do not have hospice services. Also, hospice recipients are more likely to have their pain controlled and less likely to undergo tests or to be given medicines they don't need compared with people who don't use hospice care. Like I said, hospice is a team approach, and they will, of course, work with you on that and make sure that the patient is not taking anything that they do not need. What does the 6 month hospice, what does the hospice 6 month requirement mean? Some people uh, misinterpret their doctor's suggestion to consider hospice. They think it means death is very near, but that's not always the case. Sometimes people don't begin hospice care soon enough to take full advantage of the help it offers. Perhaps they waited too long to begin hospice care. They're too close to death. Or some people are not eligible for hospice care soon enough to receive its full benefit. In the United States, people enrolled in Medicare can receive hospice care if their provider thinks they have less than 6 months to live should the disease take its usual course. Doctors have a hard time predicting how long an older, sick person will live. Health often declines slowly, and some people might need a lot of help with daily living for more than 6 months before they die. Talk to doctors if you think a hospice program might be helpful, whether he or she tells you or not. If he or she agrees but thinks it's too soon for Medicare to cover the services, then you can investigate how to pay for the services that are needed. There's always options. What happens if somebody under hospice care lives longer than 6 months? If a doctor continues to certify that the person is close to dying, Medicare will continue to pay for hospice services. It is also possible to leave the hospice care for a while and then return if the healthcare provider still believes the patient has 6 months or less to live. So let's keep that in mind, people. If the person, they give 6 months and it's 7, 8, 9, 10, 12 months to a year, which has happened to a lot of people actually, you can, of course, request that your doctor resubmit the paperwork to Medicare if they still believe that they're nearing death and they have 6 months or less to live. Like I said, doctors are not gods. The only person that can determine when you're leaving this earth is God and you. I guess I put it that way. So let's keep that in mind. In hospitals, and this is the part about hospitals, because like I said, there's all kind of places and things that you can receive towards the end of care. Uh-oh. And like I said, hospitals is the next one. Uh-oh. Okay, yeah, I'm trying to find something. Give me 1 second. Okay, I was trying to make sure I found out what I was trying to say, but it's talking about the care options. Don't forget that this section is called care options at the end of life. So there's all kind of care options. So far, we went over hospice. We actually went over palliative care first, and then hospice. And now we're moving to care in the hospital. And this is Omar's story. Now, I know you all keep seeing the light coming through my skylight in the bathroom. Outside, of course, my entire bathroom is glass, so of course you're going to keep seeing the shadow, the clouds, and that kind of thing. Luckily, it's bright because at first I was looking like a ghost in here. But this is Omar's story. Omar is 64, lives at home, and has a history of congestive heart failure. He has decided that no matter what, he wants the doctor to do everything medically possible to extend his life. Those closest to Omar agree. One night, Omar wakes up with chest pain and is taken to the hospital where doctors and nurses are available around the clock. Hospitals offer a full range of treatment choices, tests, and other medical care. If Omar's heart continues to fail, he can receive care in the intensive care unit, ICU, or the coronary care unit, CCU. Although hospitals have rules, they can sometimes be flexible. If Omar's doctor thinks he's not responding to treatment and is dying, the family can ask for relaxed visiting hours. And I remember this with a lot of family that I've had, my mom, my stepfather at the time, my father-in-law at the time, and other folks that I've had in my family and friends who are passing away at the hospital. My grandmother, they, of course, will let you, I know they usually have visiting hours and stuff like that, but just keep in mind that if you talk to the nurses and the doctors, or just the nurses, whoever's there on staff, they will let you stay past those visiting hours. They will, of course, allow you to, of course, stay overnight in most situations as well. You just have to ask and make sure that you're following the policies and rules. If Omar's family wants to bring personal items from home, they can ask the staff if there are space limitations or if disinfection is needed. So you can, of course, if it's going to be an extended stay for a few days or a week or that kind of thing, you can start bringing items from home that the person can identify with and love, and whether it's teddy bears or photos or that kind of thing, just get permission first. Oh, and also, because I know when we had several people in ICU, and we could not bring in plants, certain live plants, or plants period. So just make sure that you're asking the doctors and nurses about whether you can bring in, I guess, like plants and helium balloons and different things like that. Because in most of the ICUs that I've been in or been with family, that kind of thing, those kind of things were prohibited. So just keep that in mind. Just ask for permission first. In a hospital setting, medical professionals are available who know what needs to be done for someone who is dying. This can be very reassuring. In addition to the regular care team, some hospitals may have palliative care teams that can assist with managing uncomfortable symptoms and making medical decisions for patients who may or may not be at the end of life. Just keep that in mind because most hospitals have those palliative care teams, the hospice teams, and they also have chaplains available as well if that's what you need. The doctors want to move my relative to ICU. What can we expect? The intensive care unit, ICU, or coronary care unit, CCU, are types of critical units. These units are parts of a hospital where seriously ill patients can benefit from specially trained staff who have quick access to advanced treatments and equipment. The medical staff in ICUs and CCUs closely monitor and care for a small number of patients. And when I've been in ICUs or CCUs, it's been no more than about 10 or 15 patients back there at a time. That's like the only amount of rooms they have back there, actually. Now, there's other hospitals that may have more, but the ones I've been in, that's about the highest number I've seen. The medical staff in ICUs work in CCUs closely monitor and care for a small number of patients. Doctors who work in these units are called intensivists. Patients in the ICU or CCU are often connected to monitors that check breathing, heart rate, pulse, blood pressure, and oxygen levels, and that's usually all the time. An IV intravenous tube may supply medicines, fluids, and our nutrition as well. Another tube called a Foley catheter may take urine out of the body. A tube through the nose or stomach area may provide nutrition and remove unwanted fluids off the body. A breathing tube may be attached to a ventilator or respirator to help with breathing. Often these external supports, designed to be used for a short time, will maintain vital functions while the body heals. But sometimes, even with intensive care, the body can heal and organs start to fail. When this happens, survival is unlikely. In this case, the healthcare team may talk to the family and the patient, if he or she is conscious, about considering whether or not to continue intensive treatment. And just keep in mind that that is something hard to deal with. I've dealt with that numerous times, but just keep in mind that even though it's, of course, a very emotional time, that if you can't talk, find somebody else in the family or a friend of yours that can represent the family to speak, so that you can get all the information that you need for the dying person to know what's going on, what's going to happen, and what you all can do in the process, and what the doctors and nurses are going to be doing as well. The next is nursing homes, because of course somebody can be in a nursing home towards the end of life as well. More and more people are in nursing homes at the end of life. In a nursing home, nursing staff are always present 24 hours a day, 7 days a week. Unlike a hospital, a doctor is not in the facility all the time, but may be available by phone or on call. Plans for end of life can be arranged ahead of time, so that when the time comes, care can be provided as needed without first consulting a doctor. If the person has lived in a nursing home for a while, the staff and family probably already have a relationship. This can make the care feel more personalized than at a hospital. This can make the care feel, additionally, if the person is enrolled in hospice, the hospice care team will be available to assist nursing facility staff with end-of-life care. As in a hospital, privacy may be used in a nursing home. You can ask if arrangements can be made to give your family more time alone when needed. I need to take a break and get some water. Alrighty, and the last one of the other sections is home. Home is likely the most familiar setting for someone who needs end-of-life care. And most people that I've talked to or dealt with, I guess family-wise as well, they stated that they wanted to be at home during those last dying days, even though some of the situations that could not occur because of the illnesses and because of what was going on symptom-wise and stuff like that at the time. So sometimes that didn't happen, but as much as you can, the person is requesting that, please ask and get some assistance as far as what you can do to make that possible. Family and friends can come and go freely at home. Care at home can be a big job for family and friends, physically, emotionally, and financially. But there are benefits too. And it is often a job caregivers are willing to take on. Hiring a home nurse is an option for people who need additional help and have the financial resources. And a home nurse, it can be either an actual nurse, LPN, that kind of thing, from like a specialty clinic or whatnot, or it can be somebody from a home healthcare company as well. I work for a home healthcare company here in St. Louis, Missouri, and we do provide CNAs and aides to go out to the home to assist people in their daily living skills. I guess I put it that way, making sure that they're getting bathed and having food to eat and those kind of things, and giving that caregiver respite time, or just a break. I guess while they're there, so the caregiver can focus on other tasks in the household. Talk with your healthcare provider about the kind of care needed. Frequently, this care does not require a nurse, but can be provided by nursing assistants, like I just said, or family and friends without medical training, and that is the truth. So if you have somebody in your family that, of course, that has that does or does not have training to help take care of someone, of course, you can let them know how to do it and go ahead and get what you need done. Who pays for care at the end of life? How to pay for care at the end of life depends on the type and place of care and the kind of insurance. Medicare, Medicaid, private insurance, long-term care insurance, which they don't really talk about a lot, but long-term care insurance is the kind of insurance that you pay into at this age. I guess I'm 40, or if you're 30, or whatever age you are, to help provide the end-of-life care, just in case you need to go into a nursing facility or any other type of facility, assisted living, that kind of thing. A lot of people do not talk about this, but for those who know that they only will have Social Security at the end of life, or when they're getting older, that kind of thing, this kind of care and this kind of insurance can definitely help you. Like I said, you'd actually have to research what's in your area. I know they don't talk about it a lot, but long-term care insurance can, of course, assist in paying for those long-term cares, whether that's in a nursing facility, assisted living, that kind of thing. So definitely look into it in your area. Like I said, most folks, you never even hear anybody talking about it, but there are policies out there that's only geared towards long-term care insurance. And there's also Veteran Health Administration, if you're VA eligible, or the patient and his or her family, or common sources of payment as well. I guess that's who pay for the end of life. Like I said, I know some families, it can be a hardship to pay for the end of life care. And if you have one of these insurances, or even if you don't have one of these insurances, especially with the Medicare and Medicaid, make sure that you have applied for these things and try to get as much help as you can. Sometimes, of course, I guess I can go over that on a different video about Medicare and Medicaid, and do some education about that as well. But like I said, those are two insurances that's out there. They can, of course, assist in any type of end-of-life care that you may need. To make comfort care available at home, you would have to arrange for services such as visiting nurses, special equipment like a hospital bed or bedside commode, and all those kind of things. The equipment that you'll need at home, whether it's a hospital bed, bedside commode, anything along those lines, ask your care team, the palliative care team, or if you're working with the hospice care team, or even the doctor, they can all, of course, write orders for that. So you will not have to pay for those items at all. It can just go through the insurance. So just keep that in mind. Most places will not tell you that, but like I said, I'm telling you that because I'm learning all these things through the job that I'm working, being the social worker. Also, I have had a lot of clients who've called me to ask about diapers and like bed, what is it called? The bed pads. I guess for somebody who cannot control their urine or bowel movements towards the end of life, or actually any time, not just end of life. But like I said, those items can also be given to you for free through your insurance. You have to ask your doctor to write an order for those items for you. They will not tell you that, but the insurance companies, Medicaid, Medicare, will pay for that. Now you may not get the quality depends or that kind of thing at all, but you will, of course, get some kind of off-brand item possibly, unless you're able to pay for that extra depends, or whichever the case may be, through the insurance company, because it may be a small copay for those higher types of, like diapers and those kind of things. But just keep that in mind. Like I said, the doctors, you let them know that you're having urination problems and you can't hold your urine, or or your loved one is. And like I said, they will assist you in, of course, writing that order so that you all can receive those items for free. So you all will not have to pay for all those depends and diapers and stuff like that. Health insurance might only cover these services and equipment if they have been ordered by a doctor, like I just said. Make sure you check with your insurance company before ordering. Work with the doctor to decide what is needed to support comfort care at home. If a seriously ill person is returning home from the hospital, sometimes a hospital discharge planner, often a social worker, can help with that planning, which is myself. Your local area agency on aging might be able to recommend other sources of help, and they have those the local area agency on aging. They should be all across the U.S. actually. You just have to look it up to see what's in your area. A doctor has to be available to oversee the patient's care at home. He or she will arrange for new services, adjust treatments, and order medicines as needed. It's important to follow the doctor's plan in order to make the dying person as comfortable as possible while at home. Talk with your doctor if you think a treatment is no longer helping. Hospice is frequently used to care for people who are at home at the end of life, so keep that in mind. I just went over hospice, so let's keep that in mind. Questions to ask about end of life decisions. Choosing among the different options for care at the end of life can be difficult. Here are some questions that may help you determine what is best for you and your family. If we continue the current course of treatment, what do you expect will happen next? What kind of end of life care is needed for my loved one? Is the most likely caregiver able to give that kind of care? Where would the person who is dying want to have his or her end of life care? A facility or at home, for example? What is the best place to get the type of care he or she wants? Who will pay for this care? Can we get help paying for respite care? Is there a good chance that treatment in an intensive care unit will reverse the dying process or instead draw it out? Those are definitely questions that you want to ask once you're thinking about your care options, where you want the dying person to be, and what they've actually, of course, suggested. I guess where they have suggested that they want to be as well. So like I said, whatever they've told you, if it's at home, hospital, see if you can make that happen. If it cannot be at home for whatever kind of circumstance you're going through, just try to explain as best as you can to the dying person that that's not an option at this time, and because you have to do what you have to do according to the medical facility staff, that kind of thing, and it depends on the disease as well. But just keep that in mind. And they give some resources about learning more about the care options at end of life. But like I always say in all my other videos, please just research on Google whatever's in your area. It should come up. Whether it's because they have the Center to Advanced Palliative Care, the Hospice Foundation of America, the Visiting Nurses Associations of America. They have all those things. And they also have an elder care locator. And we have elder care here, that same kind of care, of course, for our seniors and our elders here in St. Louis as well. And that's all across the U.S., so just keep that in mind. Elder care, of course, they can provide attorneys if you need whatnot. I think that's in this book, and I will get to that, of course, later on in this book as well. But they will, of course, provide attorneys. They will, of course, let you know what kind of care options are out there available for your loved one as far as elder, sick and dying, that kind of thing as well. So just keep those things in mind. And with that, like I said, I'm going to get off of this video, and I want to thank you again for choosing to listen to Tonetta Clay and my Tonetta Clay's channel with Truth Sense here on YouTube. I just want to thank you for, of course, tuning in and for checking out this video. And I hope that these care options that's at the end of life that has been discussed is palliative care, hospice care, a hospital, and at home. I hope that in a nursing home as well. I hope that these, of course, open up your mind to, of course, figure out what kind of care you may want for yourself when you're towards this, towards the end of life, or the kind of care that you want for your loved one who is already in this position. Like I said, these are definitely the only 5 ways, I guess, that you can, of course, receive care. I guess I want to say are the only 5 situations. I guess I can say that. Usually they come in a combination, not just one at home. You have palliative care, or you have hospice care at home as well. All these services, of course, palliative care and hospice care, can be, like I said before, can be provided at home or in a facility. So just keep that in mind instead of me going on and on and on. Like I said, I want to thank you all for tuning into this video. I know this one probably like a little bit longer than the other ones because they had a lot of information to give. And I still have information to give, of course, about palliative care and all those kind of things, but I'll do that in another video because this video will be about an hour long if not. So I just want to end here. And like I said, thank you again for tuning in to part 3, Care Options at the End of Life. And I hope that this helped you or helped someone that you know. Feel free again to, of course, share this video with your loved ones and your friends and your tribes and your online communities. I do not mind. Make sure that you're subscribing to this channel to, of course, get all the videos in this series and other series that I'll do as well. So I guess click that notification bell to your I guess that's to your right. So, but like I said, I want to thank you again for tuning in, and I hope that everybody has a rest of a blessed day. Thank you again. Bye bye.